I was diagnosed with lupus at the age of 20, and after 5 years of lupus, I was diagnosed with pulmonary hypertension. It came about through shortness of breath, was really what I noticed. I couldn't walk up a flight of stairs without having trouble. The most challenging part of living with multiple illnesses is managing your care, getting the physician, rheumatologist in my case, pulmonary hypertension specialist, and anybody else involved in my care, getting them to communicate effectively, efficiently, is very difficult. How I manage my medicine, every week I sit down with all my medicines out on the bed and I put them in a little container. I have a container that divides it up by day and time of day. And I have a horrible memory. This makes it so that I can't forget. All I have to do is take an entire box of pills for the day and I'm good to go.
I get up in the morning and I first of all start out with my thyroid medication and my Cellsaft, which I take those first, and then I have to wait like 45 minutes, and then I take my reflux medication, and then I wait a little bit longer, and then I start taking like my high blood pressure medication. I have 2 pulmonologists, 2 rheumatologists. I have a nephrologist, cardiologist, and a primary care physician. And so, and I have doctors in 3 different states. And I'm not so willing to talk about it to people because even close family members sometimes, you know, it's been kind of a challenge, you know, because I look good, it's hard for them to understand that I don't feel good and maybe not have the energy.
One question that people ask a great deal might be, how likely am I to get pulmonary arterial hypertension now that I have lupus? It's very clear that only a tiny proportion of people with lupus ever develop pulmonary arterial hypertension. Various experts have estimated this to be perhaps 5 in 1,000 patients with lupus, or somewhere thereabouts. Once either you or your doctor think that there may be something wrong or that you may have pulmonary arterial hypertension, it is critically important to do further testing to either confirm or find another reason why you don't feel well. This can be somewhat more complicated in lupus because in addition to pulmonary arterial hypertension, lupus can affect the heart valves, the lung, and a number of muscles that surround the lung and the chest wall. And so each of these can lead to very similar symptoms and may be very confusing when one is sorting through the many things that can cause shortness of breath or swelling of the feet in patients that may have lupus. There are currently 9 medications approved for the treatment of pulmonary arterial hypertension in the United States. It is critical to understand and to discuss these agents with your doctors. Although there are a number of general guidelines of when and which treatments to use, each patient is different. For these reasons, it is critically important that the physician that cares for your lupus and the physician that cares for your pulmonary arterial hypertension collaborate closely to help you feel as well as you can on a daily basis.
It is very important to remember that if you have PH that's caused by another illness, you cannot treat them separately. You have to treat PH and lupus.
Again, we have to listen to ourselves and to how we're feeling, and then be able to talk to our doctor about it.
I'm involved with the PH Plus, and it's really nice to have people who also are living with lupus that you can talk to that, oh yes, I know exactly what you're talking about. I have the PH fog or the lupus brain. You know, remind yourself that you're not alone.
With really good care and medication, there's hope. I was given a prognosis of just a few months, and I was told to go to my priest and make my final arrangements, and it has been 13 years, so there's hope.